Today we will be discussing chronic pain and exercise. Please note that in this talk we are referring to musculoskeletal pain, not cardiac pain. To learn more about how to tell the difference between the two, please watch our Keeping Exercise Safe talk listed in the notes below. On the agenda today we will discuss what pain is and how the body responds to it, why pain management is important, how exercise impacts pain, and strategies to increase your activity levels. Pain is defined as an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. Pain is always a personal experience that is influenced to varying degrees by biological, psychological, and social factors. A person's report of an experience as pain should be respected. Through our life experiences, individuals learn the concept of pain, and although pain usually serves an adaptive role, it may have adverse effects on function and social or psychological well-being. Acute pain has a recent onset of less than 3 months and often related to things like recent injury or infection. When pain persists beyond the normal healing times of a tissue injury, we call this chronic or persisting pain. Chronic pain can negatively impact a person's ability to complete normal everyday activities and can become emotionally or mentally exhausting. It is important to highlight that the experience of pain is unique to an individual and can depend on multiple factors, including mood, past pain experiences, thoughts and beliefs, what other people say, including therapists, and what you know about your pain or injury. Almost 8 million Canadians live with chronic pain, many of whom report it adversely affects some or most daily activities. 1 in 5 of us experience pain throughout our lifetime. People living with chronic pain are twice as likely to experience anxiety or depression. 1 in 5 children and youth experience pain, which can have effects throughout their later life. 1 in 3 people over the age of 65 experience chronic pain. Chronic pain also has a massive economic impact. According to Health Canada's analyses, the direct healthcare costs are $7 billion per year. And when we also include the indirect costs of lost production and wages, chronic pain cost Canada over $38 billion in 2019. As Canada's population ages, the prevalence of chronic pain and its impacts are expected to grow. Preliminary projections indicate as many as 9 million Canadians living with chronic pain by 2030, with the estimated costs reaching $55 billion per year. So investing in pain prevention and management has the potential to not only improve outcomes for individual Canadians, but to also deliver sizable economic savings. To better understand musculoskeletal pain, it may be helpful to first learn about the nervous system. Specialized nerves, called nociceptors, are widely distributed throughout the body, including in the skin, muscles, joints, bones, and internal organs. Nociceptors are danger detectors and help protect the body from harm by transmitting information to the nervous system about potentially harmful changes that occur throughout the body. For example, pressure on joints, stretch in muscles, skin temperature, or inflammatory chemicals released from injured tissues. When these changes are detected, nociceptors send danger signals to the brain. It is important to understand that nociceptors transmit only danger signals, not pain, to the brain. These danger signals are then weighed up by the brain along with stored information from previous experiences and what has been learned to determine if there is a threat to the body's tissues. If the brain decides there is credible evidence of threat, pain is produced to start the protective behaviors to avoid harm to the body. For example, a familiar protective behavioral response to pain from long hours of sitting is to stand up, stretch, and move around. This unloads the body's tissues and nociceptors stop sending danger signals. In the absence of threat and with no need to protect, the brain stops producing pain. Pain is one of the body's most important protective responses, the brain alerting us to the need to take action to avoid harm or injury. For example, if we sprain our ankle, the pain experienced initially limits us from weight bearing, resulting in less load being placed on the ankle to promote healing, recovery, and reduce risk of further injury. Acute pain is typically worse when the initial injury occurs. Having some pain, although unpleasant, means your body is doing what it needs to do to keep you safe and heal. And the swelling and redness is evidence of the self-healing powers of your body's tissues already being hard at work. As injuries are treated and heal, there is less need to protect, so pain reduces with other symptoms like swelling, bruising, or redness subsiding over time. And as they become more tolerable, you'll find that it is safe to gradually go back to usual activities. Sometimes pain doesn't subside despite normal tissue healing, with pain persisting long after the body's tissues have healed. However, pain becomes a less reliable indicator of tissue damage the longer it persists. Once someone is experiencing chronic pain, they may have a larger than normal pain response, even though there is less danger present. For example, experiencing pain during a previously pain-free activity can be a sign of chronic pain. Thoughts and emotions play a larger role the longer that chronic pain persists. So the more a person learns about pain and the better they understand their own pain experience, the greater the likelihood of retraining the brain towards recovery and getting back to normal daily activities. If you're one of many people who experience chronic pain each day, right now you might find yourself asking questions like, why has my pain gotten worse over time? Why is my pain lasting longer than expected? Why does my pain flare up unpredictably? Why has my pain spread to other parts of my body? As pain persists, the body adapts by becoming more protective. This involves changes to the brain and nervous system, including a heightened sensitivity to danger signals and threat. This results in the brain and body systems becoming overprotective and overreactive. For example, a car alarm that goes off every time a leaf lands on the hood. An overprotective nervous system may negatively affect how you engage in everyday activities and interact with colleagues, friends, and family members. The good news is, our nervous system can be retrained to be less overprotective, decreasing pain sensations. Changes in our brain that reshape existing pain pathways and form new connections that inhibit pain processing also contribute to pain desensitization. Exercise and physical activity play a key role in reducing pain sensitivity, which will allow you to return to participating in activities that you may have had to give up due to your pain. The way we think about and experience the world influences how a danger signal is processed in the brain and the pain we experience. For example, some people predict that doing weights is bad for my back because they've heard of someone who had a back injury trying to move something very heavy. However, these back exercises are likely to feel difficult because they've been avoided, and so the muscles are now weakened. Research shows a link between higher stress levels being associated with higher pain levels. Treatments that reduce stress and promote relaxation, including exercise and physical activity, are key components in pain rehabilitation programs. For more information on stress management strategies, please refer to our other talks, Stress and Your Health, and Emotional Challenges. Distraction techniques have been shown to decrease people's pain in the short term. Some examples include mindfulness, playing an instrument or game, focusing on controlled breathing, virtual reality, or short meditations. This doesn't mean that you can actually distract your way out of pain, but shows that learning ways to change unhelpful thoughts, beliefs, and emotions can reduce the impact of chronic pain. A reminder that in this talk we are referring to musculoskeletal pain, not cardiac pain. To learn more to differentiate between the two, please look at our Keeping Exercise Safe talk listed in the notes below. Exercise is considered a safe and effective treatment for people living with chronic pain. Many researchers and health professionals recognize that increasing physical activity levels can improve pain, function, and well-being across a range of chronic pain conditions. It is important that you are assessed by a suitably qualified exercise professional, such as a registered kinesiologist, to make sure that there will be no serious risks prior to commencing an exercise program. Remember that the relationship between physical activity and pain is complex. For example, people with chronic pain may experience an increase in their symptoms during their exercise sessions, which can lead them to believe that they should avoid exercise in the future. However, we know that regular exercise helps reduce pain and improve function and quality of life for people living with chronic pain. Benefits of exercise for chronic pain include improved muscle strength and endurance, better mobility with lubricated joints, and increased flexibility. While these adaptations are important, we also know that regular exercise and physical activity have multiple positive changes in all the body systems, including for our cardiovascular health. Other exercise-related health benefits for people with chronic pain include improved sleep, improved mood and reduced anxiety and stress by releasing endorphins and dopamine, increased pain tolerance and pain desensitization, and improved immune function by reducing systemic inflammation. Exercise is an effective and beneficial treatment for chronic pain through the combined effects of multiple positive changes in the body, brain, and nervous system that improve physical and psychological well-being. Most importantly, exercise can be safe and reduce the potential harm and side effects associated with some medications or medical procedures commonly used to treat chronic pain. So how can people with chronic pain keep active, especially considering the complex interaction between physical activity and pain? We will now explore practical tips and techniques of how you can introduce exercise back into your life to help manage chronic pain. An important first step can be to understand your current activity levels and patterns. When it comes to physical activity in people with pain, we commonly see two distinct activity patterns, persisters and avoiders. Persisters are those who continue to push on with their daily activities despite pain. While this might seem manageable for a time, eventually this overactivity can catch up and pain increases beyond tolerable levels, forcing someone to rest for extended periods until the pain subsides. If you feel like this describes you, try dividing your daily activities into smaller, more manageable portions, or spreading out tasks across the day or week. This activity pacing can be a useful starting point to stabilize symptoms before engaging in a more structured, graded activity like an exercise program. Avoiders, on the other hand, are those who avoid activity for fear of worsened symptoms or that they are causing damage to themselves when their pain increases with activity. Over time, this avoidance leads to deconditioning and subsequently a lower tolerance for exercise. When avoiders do try to exercise again, their lower tolerance for activity means that they may experience even greater increases in pain. So once again, they avoid activity and the cycle continues. If you identify with this avoider pattern of activity, consider a graded exposure or graded activities as useful behavioral strategies to improve your tolerance for activity. This means start small and gradually increase step by step with small changes towards your end goal. Becoming more physically active can be difficult for many people, and particularly true of those living with pain, because of the effect that physical activity can have on their symptoms. Goal setting is one of several strategies that can be used to become more active and stay engaged in activity. It is very common for people with pain to want to be pain-free. Unfortunately, the complex nature of chronic pain means that this is rarely a realistic goal. Instead, it is important for people with pain to aim for staying engaged in activities that matter to them. Research has shown when we focus more on staying engaged in meaningful activities and on keeping active, rather than focusing on resolving our pain, we experience pain relief. To identify what matters to you, you may ask yourself, if I didn't have pain, what would I be doing? This could be in the form of structured exercises like walking or going to the gym, hobbies like sports or gardening, or even social activities like going out for dinner with friends. Once you've identified goals that you want to achieve, you can start the strategies that we'll outline here to gradually put them into action. We also have a specialised goal setting education talk called Keeping on Track. Once you have figured out the activities you currently struggle with due to your pain, you can use these to set up a graded exposure exercise program. Start with a short amount of the task and gradually do more and more until you have achieved your desired goal. This sounds simple, but can be quite challenging and scary to start with when you have pain. Remember that pain is very individualized, and so should your approach be to getting started with moving again. Let's use gardening as an example goal. When starting an exercise, start with a task and an amount that you are confident you can achieve and is unlikely to lead to prolonged exacerbation of symptoms. You should feel at least 8 out of 10 on a confidence scale that you can achieve this task pain-free. This may mean starting at a level of exercise that seems too easy to be beneficial, though this isn't the case. Starting with a small amount of exercise is a great way to increase your overall confidence as you achieve these early goals. Using a timelined or scheduled strategy can be useful once you have become used to the exercise that you have chosen. This means creating a plan as to how much you will increase the activity despite your symptoms. For example, watering half the plants every other day at the moment, but by the end of next week, watering them all at once. If you are unable to perform the activity you've chosen for your graded exposure, it may sometimes be necessary to reduce the task to start with. For example, if you currently cannot do even a small amount of gardening, like watering half the plants, you may have to break it down into its basic parts. This may be as simple as doing some forward bending towards the floor inside your house to replicate the action of watering the plants. From here, you might be making it more difficult by doing the same movement with a small weight in your hand to replicate holding the watering can. Gradually make the activity harder and longer as your capacity increases, and ultimately transitioning back to the garden at some point along your journey. Pain experienced during the activity as you return can be a barrier to successfully engaging in exercise again. It is normal and expected that you will experience some pain when returning to activities while recovering from chronic pain. In fact, these painful exercises can have a significant benefit over pain-free tasks when it comes to reducing pain, as we are able to prove to ourselves that we can overcome the emotional component of pain. Although it is generally safe to exercise despite pain, you may find it useful to follow these guidelines regarding an acceptable amount of pain. If you are coping with the level of pain, then continue to exercise. If you find that your pain is more than tolerable or your flare-ups last more than 24 hours after your exercise, reduce the amount of the task that you are doing until you can cope with it again. It is important to adjust the exercises depending on your symptoms. Try to avoid not doing the exercise altogether, as complete rest is unlikely to help. Ask yourself, what pain patterns do you notice? What pain management strategies work best for you? Consider when you have recovered from an injury, but sometime later feel pain doing a simple activity. How do you approach that activity from then on? What would you do if you didn't have pain? Have you tried getting started with gentle movements? How will you timeline your increase in activity? For more information, speak with your exercise therapist, visit the Pain Canada website for more resources, or check out our other education pieces. Thank you.